putting the spotlight on women's health is very important, because some of you may know that women tend to live longer, but in ill health. But not all of you may perhaps be aware of the fact that treatment options for men and women are very different, and our knowledge about it is very limited. For example, when it comes to the gender data gap, not everyone may be aware of the fact that, for example, in clinical trials, still, and I have been involved in the clinical trials negotiations 2014, so that's a long time ago, but that still a lot of men are taking part in clinical trials and women not as much. Which means that the understanding of, let's say, female medicine is really limited, and I think that needs to change. I think overall also when it comes to data and what we know about the complexity of the female body, but also about research, data, I think there's still a lot of gaps and need to work on that, let alone to speak about empowerment and literacy in this area. Also, when you think about it from a policy perspective, it's great that now for the first time there is a female president of the European Commission who is a medical doctor herself. So you can feel that for her, issues related to gender are more important and are much higher on her agenda than for the previous male presidents. So she would speak a lot about the gender pay gap, the gender pension gap, and all these issues, violence against women. But still, I think the whole perception that a focus on putting female health, women's health in the spotlight is still relatively limited. So for that reason, I'm very, very happy to have a great panel this afternoon with a lot of people with great expertise. So I would like to ask all of you to come to the stage. And while you're coming to the stage, I would like to stress that what we're after this session, and I think especially in a post-lunch session, is an interactive session where also we're very much looking to you to see what kind of questions you have. And we're aiming to have, Rutger-Jan, perhaps in terms of the gender balance, you come in the middle. And we're really aiming to have very practical solutions. So what we're going to do is that we focus first on what can be done to reduce gender inequities in health, how can health literacy be improved, and how is technology contributing to all these issues. So we're going to try to stick to that order, but I already told my panelists, don't feel free and don't hesitate to perhaps interrupt each other, because you all have a wealth of knowledge. And perhaps by saying that, Jessica Ennis-Hill, the creative director of Janus, and I'm sure that you're going to speak about it yourself and explain this new femtech business, which I think is great. You're also an Olympic champion, so from your own experience, you know a lot about the complexity of the female body. And to start with, I'm looking for your key piece of advice when it comes to female empowerment and the need for more education and research in this area.
Mic's on. Oh, there we go. I think for me, my background obviously is athletics and sport, and I've come from.
I'm looking perhaps because it seems that the mic is hampering. Oh, we're going to get a handheld mic. So please bear with us because a handheld mic, yeah, that would be great. It's coming.
Thank you. Yes, so I come from a sporting background, and just to give you a bit of background of how I've kind of found myself in this space, I, was in this area of sport, of elite sport, where, everything that you do is about marginal gains. It's about how do you look at every part of your body, your nutrition, your psychology, your biomechanisms, all that kind of detail to how you get the best performance out of yourself. And yet during those years of being a professional athlete, there was never one conversation or real focus on how my hormones, my menstrual cycle, or my physiology as a woman affected my performance. And, I continued through my career, and it wasn't until the point where I had my son during the end of my career, and I was on this whole kind of, hormonal journey, this transformation of how your body changes as a woman, and then how you come back to, your postnatal journey and back into sport for me as an elite athlete. And actually, I had great people around me, but they still didn't have the education and the understanding to really know how my body had changed in that way. And it kind of just opened my eyes and made me realize that when we're in a sport and a world where everything is so highly focused, this was an area of massive neglect. And if that's what sportswomen face, and it's not just in athletics, it's in a range of different sports, then actually what does an everyday woman face going through these major stages in her life? And it made me, want to create a platform whereby, how do we put more literature out there? How do we educate more women to understand their hormones? So let's strip it right back to their menstrual cycle. The 4 phases of our cycle, how does that affect us on a day-to-day basis? How does that affect the way we move as women? And it kind of blew my mind that actually I was not aware of how big this gender data gap was, and I didn't realise how little most women know and how much they put up with certain levels of pain and discomfort because they lack the control and the education around it to make a real change. And that's something that was, a huge eye-opener for me and it gave me that kind of passion to want to go in and make a change.
Well, that's a great start, and I'm sure that you're going to speak about Janice and also the use of data in that context. But let me first turn to Anna. Anna, you're representing the Women's Brain Project, and we already alluded to it. It's not widely known that diseases impact men and women differently. So I know that you have been very busy in this area, and there's great achievements and examples to mention when it comes to tackling disparities in women's health. So what lessons have you learned, and can you elaborate that for the audience?
Thank you so much, Elizabeth. First of all, we have this rather unusual name, Women's Brain Project. So it's not to say we're just interested in women's brains, far from it. We're interested in all brains. So we were set up a number of years back, and basically what we aim to do is looking at sex and gender differences in brain health and mental health as a gateway to both precision medicine and precision care. Now, it also comes back to Dame Jessica was raising about, the challenges as well when we talk about women's health and hormones and so on. What actually is women's health? Because for us, we can't define it too narrowly. So when we, not to put it too crudely, but at Women's Brain Project, we call it, and we're, just to add also, we're a global organization. We're based in Switzerland, but we operate internationally. We're first and foremost, we're led by the science and research, but we're also very much led by the policy side, which I head up. So our starting point is that what is women's health? So traditionally, and even for myself some years back, you would have asked me, Anna, what is women's health? And I'd say, oh, well, it's what we call bikini medicine. It's like, breast cancer, reproductive system, things that make us very different to male versus female. But actually, women's health is also Alzheimer's. So I'm just going to give you a few startling statistics. So 2/3 of all Alzheimer patients are female. 2/3 of all multiple sclerosis patients are female. Migraine is 3 times more common in women as opposed to men. And then when we look at stroke, we think of stroke traditionally somewhat as a male disease, but post-menopause, so menopause is a huge topic as well when it comes to brain health and mental health. When post-menopause, stroke is more common in women as opposed to men. Also, when we come to more mental health conditions, when we come to anxiety and depression, that's twice as common in females as opposed to males. And then we look at other neurological conditions like Parkinson's, where basically in Parkinson's disease, the incidence levels are slightly higher in males as opposed to females. But there, when, for instance, women, and they can even get at relatively young ages, Parkinson's, the treatments are not fit for purpose. And there, historically, we go back to issues with clinical trial representation, where women have not really been represented for safety reasons. And this goes back to the late 50s, early 60s with the thalidomide tragedy. And the result of that was actually the EU pharmaceutical legislation. So regulators are very, very cautious when it comes to putting women, especially women of childbearing years, into clinical trials, and rightly so. So we at Women's Brain Project, we work very closely, not just at a policy level, very much with the World Health Organization, OECD, also EU policymakers, but we work across globally with regulators like the FDA in the States, We work very closely with Health Canada and also the European Medicines Agency, national regulators, to ensure we also have clinical trial framework that is obviously safe, because safe is priority, but we also want this, that it's also working for patients. And we want to ensure, for us, really our starting point is that we want to move away from this, what we call this one-size-fits-all agenda, where we take, no disrespect to Rutger here, but we take a white man of middle-aged years, a certain weight, a certain build, and we extrapolate from that medical model that's going to work for Dame Jessica, it's going to work for Pooja, it's going to work for Elizabeth, it's going to work for me, and it doesn't work. So we need to have this precision medicine, also precision care approach, and very much as part of that is looking also from a socio-economic perspective, the burden also on women as caregivers as well, because that has direct implications when it comes to brain health and mental health.
Well, thank you so much, Anna. I indeed would like to turn to Rutger-Jan, because we started speaking also about policy making and the importance of bringing the topic to the political agenda. And I know that in your career you have worked a lot on this, and I think very rightly during the preparatory call that we had last week, you mentioned that it's been over 60 years since we have the Treaty of Rome, where gender equality was actually already enshrined in the treaty. But no country really has succeeded it, and I think worse, there's lots of differences between countries. So how can policymakers and also people like yourself and organizations, healthcare organizations that you work with, how can they ensure to work together to address women's concerns and what you just heard from the other speakers?
Yes, well, I must start with a confession. My wife and I had 3 children, and we didn't breastfeed them because we want to bottle feed them 50-50. So I bottle fed my children as often as my wife did. But when they grew up, when they had a problem, they wanted to speak to my wife. When they needed money, they wanted to speak with me. But a couple of years ago, 20 years ago, I had really an eye-opener, because one of my PhD students came and said, I have a woman with autism and addiction. And I thought, wow, I can't imagine people with autism being addicted, but they use a lot of medicine when you ask them. And we hardly ever saw girls with autism. And that opened my eyes to the tremendous diagnostic delay that we see in women as compared to men. And that rejoins what Anna was saying. Most of the diseases or disorders or conditions like autism have been studied and described in men. And we don't know what the criteria are for women. For schizophrenia, for instance, 6 to 8 years delay, and where in men schizophrenia improves after menopause, at the end of their life, in women it worsens after menopause. In the Radboud University where I work, we attracted Angela Maas, who opened our eyes for heart conditions in women. A heart attack in women manifests in a completely different way. So one of the very important things we are doing with the European Institute of Women's Health is really ring the bell in the European Commission, referring to what you were saying. Gender equality and equity is in the EU enshrined in all the laws, but it's not in place. And when it comes to healthcare, 50% of the European population are women. And we see that, exactly as Anna was saying, there's too little attention for work-life balance. These social and commercial determinants of health are grossly underestimated. And during the corona pandemic, we saw that men working at home were very effective. You know, they were working on their laptop, minding their children that were looking cartoons on Netflix, whereas the women were far less productive, and nothing was done about that. I remember that some universities said, well, then we will diminish the productivity demands for women. And I was very angry. I said, And why not for men? Let those men look after their children and make wait for their spouses or their partners to work at home. So I think there's a lot to do. And one of the things I'm very glad about is that the European Institute of Women's Health is very strong in statements. So we're working, but now we are creating a women's health interest group. And you're all invited to the launching of that group on Monday, October 23rd in the European Parliament. And we hope that for the next European elections, women's health will be high on the agenda.
Absolutely. Well, thanks for that, Radriaan. I think, again, the topic being high on the political agenda is important, but also, indeed, having the capital to indeed fund research to have more understanding of what women's health needs. So, Pooja, I would like to turn to you as a health tech venture capitalist, because I think your community, if I may say, is known to be rather male, I think, historically speaking, but you're working as a woman. So what would you say from your experience? How do you manage to indeed get these topics higher on the agenda and get the funding we need?
Yeah, I'm fortunate to come also from a background of being a doctor, a general practitioner, so my patients have always been half women and lots of children mixed in as well. So I'm able to bring those values and that into the mix. Yeah, historically, it's been a club that people like me never really got to join, and to be honest, it's hard to get in, and I don't know how I got here. But I think there's a lot of brave women out there putting startups together, like Jess and others, who have a lived experience of the problem and therefore are a credible first candidate to go forward and build these businesses. And it will just be the way that these kind of organisations looking at hormonal health and menstruation and menopause, for example, will go first. But I also agree with what Anna was saying, is that we need to go more mainstream in the physiological differences. I'm kind of, venture capital is really here to put a spotlight onto investment curves, and enough of a spark is there for us to follow our nose. So there's the right thing to do, and you're in this room because there's the right thing to do. Then we have my esteemed colleagues who are working in organisations where they're impact-focused. I work with an impact-focused Women and Children's Fund. But structurally, we need to get this right. So I can play my part in bringing the capital to light the fire, but pharma and all of the other big players need to also put their money where their mouth is. Now, that is happening, I think, because of two reasons. One is because the right people like yourselves are, and because of philanthropy and impact and government policies bringing a spotlight to it. Secondly, we're recognising that our economy doesn't work without women and all of the kind of long-term elements of that. And thirdly, because the use of data is becoming really democratized, or should become really democratized over the next 10 years, and effortless. So yes, we can all criticize AI and all of the different terms underneath that, but it's got a real opportunity to make it effortless to bring information from women, women's health and family approaches, and to bring that in. And on top of that, we're seeing in technology that you can simulate that in many ways. You can simulate using AI, you can simulate using VR. There's so many ways that we can expand the data pool. So I have a view that we should look forward, and I say that begrudgingly, because being a woman, you've kind of faced it, and there's so much about your body that you don't understand, and the medicine just isn't there. But I'm very futuristic about that. One little anecdote I will share, actually, is that I have a 5-year-old, and he has recently been learning about the greatest fossil hunter of British history called Mary Anning, who wasn't recognised by the Geological Society. I've been learning about this, and as a quiet feminist, I was sort of like trying to talk to him about the issue, and I think his school is talking about the issue of how women have been held back. And he said, and I said, why is it, what have they been trying to teach you? And he said, well, it's because, I said, why didn't they recognise her? And he said, because in olden days, women weren't important. And I said, it wasn't that women weren't important, it's that they weren't recognised as important. And it's this re-engineering of society that we have to do right from the early age, the way that we're thinking, and how we think of women as the beating heart of society that just starts to need to change. I know so many people are doing the work, but it just needs to become much more systemic in every action and everything we do.
Well, absolutely. I think that's a very important point. And even though you'd hope that indeed with time there's more understanding and a better understanding, I think we have seen also since COVID-19 that actually, data are really not improving but going back when it comes to the role of women as caregivers and when it comes to their health. So I think you make a very important point there. I would like to turn to the audience, but let me first say I was told that I would see time because I know that I need to be a timekeeper as well. So either if you could show that to me or let me know when I need to shut up, then I think it would be good for all of you to know for your next session. But let me turn to the audience, because it's great to have a mixed audience here this afternoon, because I think the importance of women's health is not only something that concerns women, it also concerns men. And I know that I had a few questions already in advance, so before we go on, of course, with the next questions, is there anyone who is keen to already take the floor? I see a hand, yeah, great. I think a mic is coming your way. And if you could just, yes, we're sharing the mic today. If you just could state your name and briefly your affiliation, that would be great.
Thank you. Hi, my name is Motarayo. I'm a tech founder. I'm the founder of an app called Anfani, and it's a wellness solution for Black women. And I have a question for you, Pooja. Being in the health tech venture capitalist, how can I, as a Black female founder who's building a solution for Black women, how can I emphasize, for lack of a better word, to VCs that I'm worthy to invest in and that my lived experiences actually equips me to build what I'm building?
I think we're just waiting for the mic to be back.
Oh, you should still be mic'd up now. Can you?
No, they don't.
I hope.
They're not working, I'm so sorry.
Two parts of the answer. One is don't waste your time with investors that don't appreciate the angle that you're coming from. And there are shortcut ways of trying to find out how to do that, which is go and speak to other female founders and look at Crunchbase and work backwards and figure out which is the pool that I'm working with. And when you meet an investor and you're not getting the signals, that's like going on a bad date. Just leave it there and move on. But what I would say for the investment community is that we also want to be confident that your niche that you're operating in doesn't necessarily make a good investment. And so it's also to be the other side of that coin and be like, well, it does make a good investment because this is the total market opportunity. This is where I think I've gotten in. This is where my technology is better or my proposition is better. So it's kind of two sides of the coin there, is that it's really good to be unique. It's really good to deal with the problems that aren't being dealt with. And it's really good to have the passion. And often in very early stage, we are absolutely looking for the person that will die for their company. You know, that's the traits that we're looking for, and you will have that. But it's also not to forget to be prepared for all the other things, and that actually is relatively formulaic until the point of luck, and then it's your luck as opposed to any others. I would say, though, with luck, it is a funny term to use if you've got a group of people that have been continuously marginalised or come from backgrounds that aren't pushed forward. And so it's really important as investors we think about that. But many of us are thinking about that as we do our jobs.
I hope that was,
Sorry, could I just say I completely sympathise with where you're coming from, and as a female founder as well, a Black woman in this space, it's incredibly hard, and I think you've got to exactly what you said. You've got to completely believe in what you're doing, surround yourself with great people. And from a sports background, failure is the way you get to the top. You unfortunately have to have these knockbacks, and it sends you on a journey. And when you do get to the top and you get recognised, it will be a much sweeter moment. So keep doing what you're doing, and I completely sympathise with where you are.
Absolutely. I hope that was some practical advice for you. I'm looking around. Are there any other questions at this stage? I see 2 hands, so perhaps they're in the back.
Hi, Stefano here, the Health Policy Partnership. Thanks for this discussion. I just had a question about health policy and specifically women's health strategies, national strategies. So you mentioned the different manifestations of heart attack symptoms in women. And we know that in cardiovascular disease, a lot of the women's symptoms get, there's this unconscious bias against women, right? That it might be a panic attack or anxiety or some sort. So my question is really, what are the elements that need to be incorporated in women's national health policies, and are they being incorporated? Thank you.
Well, to be honest, too few at this point. But there's growing evidence that we are getting better at recognizing the specific difference in symptomatology between men and women. And that body of evidence is growing and is affecting the policies. Because obviously, all the late diagnoses are very expensive, to put it crudely. And the earlier, for instance, take endometriosis, 1 in 10 women. The time between the first symptoms and the diagnosis is on average 7 years. 7 years of medical consumption, that is all spilt money. So it's very, very important to put this on the agenda and to make sure that the insurance companies, the hospitals, the healthcare personnel are well aware of that. To move on to something that is rather between the social determinants and psychopathology, we realize that, for instance, stress occurs much more or affects women much more than men. Somehow we've seen that in the pandemic. And then stress in women expresses itself in autoimmune diseases, in cardiovascular diseases, all kinds of diseases. And when you look at the source of the stress, it's often the work-life balance. So it's not like launch an enormous prevention program to prevent stress, but make your workers happy. Listen to women. This morning there was a lot about how to retain healthcare personnel. When you realize that 78% of the people working in the healthcare are women, and there's only 2 or 3% in the top and the managerial positions, that is absolutely a lack of equity. And if that doesn't change, the way the employers are listening to the female workforce is not going to change either. So it's not big things, and just as was said this morning, start with little things. In our hospital in Nijmegen, at a certain point of time, they changed from top-down decisions to bottom-up. And what was extraordinary was, for instance, they asked 52 women that were working in the outpatient department, can you find a solution to keep working as you are and spare 12 people to go to the intensive care during Corona? Within 4 hours, they had a program that no manager could have imagined. So listen to the people and let them decide. And the sickness rate in that department dropped to near zero, because they were all happy. If one of the children was ill, everyone stepped in, So there was much more understanding for this life-work balance, and it was contagious because many men started asking their colleagues or said that they would stay home because one of their children was ill and have their women there. So it's very important to really start grassroots. And on the other hand, as I was saying, it's extremely important to make it, to put it on the political agenda.
I think Pooja also wanted to come in.
Yeah, I wanted to comment about, I guess, from an investment perspective, where I'm really excited because the resource issue is not going to get any better. But when you can make that resource more precise and targeted, then that, and Anna alluded to it around precision medicine and personalisation, that's when you can work, upstream. And so where I'm really excited is multimodal data sets. So, kind of bringing in omics data, imaging, clinical history, and bringing that together in a sensible way. There will need to be some real joining up of when you invest in that technology and then how you align commissioning of services. So, you got to join the dots there. But I'm really hoping that in the next decade, if we light the fire, as it were, you fuel that further from a policy perspective.
I know we had another question as well, but indeed, Rutger Jan and then Anna.
I'll be brief. I completely agree, but I think the medical corps needs to paradigm shift too. We see many lonely people. We see a lot of people with debts, and there's no medicine for that. It's a social question. If people have poor housing, we have to address that in a different way. So GPs were good at that till technology kicked in, and now they're kind of missing the point of looking to the social determinants, which are much more important. If you have poor housing, if you have domestic violence, there's no pill for that, but it requires action.
I would just come back to the point because the gentleman raised specifically cardiovascular differences, and not to get too personal about this, but this is how my Women's Brain Project journey started. So some years back, my mother died of heart failure in her sleep, and also her mother actually died of heart failure in her sleep. So there's a strong family trend there. And women, this is not just an uncomfortable issue. Women die because there's lack of awareness and understanding. So it's educating all those key stakeholders. So to the sessions we had earlier today where we talk about health systems, that's all very well, but I'm a great believer in knowledge is power. So women themselves need to get educated. Healthcare professionals need to get educated, especially here in the UK in primary care settings with GPs, neurologists themselves, certainly in the brain health arena, need to be more educated when it comes to brain health and mental health. And I would say to your point about more national policy as well, we're very engaged as Women's Brain Project in the Women's Health Strategy for England here. And I love their approach because they have it sort of broadly women's health, but then they're also specifically looking at focusing on specific areas. So be that cardiovascular, be that dementia. I'm very involved as Women's Brain Project in the dementia strand of things, but it's one of those things, it's multifaceted, it's not an easy fix, it's very, very complicated, but women themselves have to get really educated in this area, and it's not just that sort of women's health, strictly reproductive medicine, it's beyond that, whether that's cardiovascular disease, which I know firsthand through family personal tragedies, and I know also very much professionally speaking at Women's Brain Project more from a brain health, mental health perspective, but it's really working with those policymakers, it's filling in the knowledge gaps. That's a key thing that we haven't really addressed at the moment, is that when you start, certainly at Women's Brain Project, we look at we try to answer these questions, like why are women disproportionately affected by brain health, mental health conditions, and you start scratching the surface, and then, okay, clinical trial representation is one aspect of it, but then to the point raised earlier about their socioeconomic aspects, you even go back to sort of basic science, preclinical situations, contexts where basically most of the medical testing is done on male mice as opposed to female mice. So there's so many layers of complexity. and all stakeholders need to be involved, also including the pharmaceutical industry, because they're the ones, obviously, who can develop the innovative medicines that are needed. As regards Alzheimer's disease, which is really, I just wanted to highlight very quickly, at the age of 45, a woman has a 1 in 5 chance of developing Alzheimer's for the rest of her life course, compared with a man at the same age of 45, he will have a 1 in 10 chance. So you can see there's stark differences there, and we need to really get more answers to these questions, and I think that's where we can work in collaboration with policy makers, and be those more politicians or officials.
Sorry, Radriaan, because I'm conscious of time, and I know that we have a question there in the back. I think, yeah, the gentleman over there.
Thank you. Mark Lodge from London Global Cancer Week. I do not want to drag this off topic, because I think this is a fantastic panel, but I just want to flag up that there is another community that actually is also underserved in terms of research, and this impacts on women's health, and that's elderly populations, say the fourth quartile of lifetime. The way that research ethics are set up, it's often there's a cut-off point. We're not having anybody over 75, for example, for treatment. I deal with cancer, and therefore that's really not at all helpful. And because there are more women living older than men, this is actually a battle that also women are going to have to fight, which is to help break down this, or rather expand or reform the way that we do research at the end of life. It's not just about the end of life, but that last 10 years, it's under-researched, and women, that impacts on women, definitely.
I completely agree. When Anna was saying it's the middle-aged white man that all the research is based on, it excludes children, women, and the elderly. And so you're absolutely right. And I think that we really have to lobby to have changes in the clinical trial regulations, because they're so restricted. And obviously, in the 50s with the thalidomide, that was a catastrophe. But they can be prevented, and it's really a question of education, also of scientists, that the RCT with control groups, etc., is not the only way of proving evidence. And we have to get used to that, to see if something that has been proven in male mice works for female mice, and if it works in children and men and elderly as well as in women. Yeah, we really need a paradigm shift, and we have to lobby to have that regulation adapted.
Absolutely, I think that's a very important point. I see a question here in the front.
Thank you so much, all the panelists. It's been so interesting, fascinating listening to all your personal stories. My name is Dr. Daisy Bennett. I'm the Chief Medical Officer of L'Oréal UK and Ireland. But more importantly, I'm also the chair of the Neurodiversity and Disability, DE&I, ERG, lots of acronyms there. So diversity, equity and inclusion, employee resource group. I guess my question comes from a lived experience. I have a daughter diagnosed with autism. So to touch on the story Rutger talked about. So there has been, we know that a lack of research in the past on neurodiverse conditions, and especially with autism, and with unconscious bias, less research with females. And therefore, the female population is underdiagnosed, which means that the help and support is not out there. So my question is, do you see, or have you seen progress in this area in terms of autism and neurodiverse conditions? Is there more research? And what do you think we can do to improve that? Thank you.
Yes, well, I'm quite optimistic in that. You know, the term neurodiversity is enriching, because it shows that It's not a disorder or disease that's separate from all of us. You know, we all have a touch of something, and neurodiversity should be cherished in a certain way. You know, there wouldn't be a computer without an autistic way of thinking. And what you see nowadays is that, first of all, we recognize that in autism, for instance, it's 50-50 in adults. And one of the things that in my country, but throughout Europe and the United States, we touch upon quite often now is treating the trauma that women with neurodiversity have endured because of wrong diagnosis. You know, having been scolded out for borderline personality disorder, hysterical, anxious, etc., etc. And once the diagnosis is made, they can be helped in a proper way. But they have this trauma of having maltreated for many, many years before.
I think probably we're approaching the end, so I would like to touch, because we said that we would touch on the gender data gap and the digital divide. And then Jessica, I know that from your experience also with Janice, you have a lot of knowledge about data. But what can we do more collectively to indeed properly ensure we have more data so that we sort of, divide that, bridge that gap?
Yeah, I think, again, it comes down to what Anna speaks about. It's the education, and it has to start right at the beginning, you know, of young girls' hormonal journeys. You know, they start puberty, and, you know, I was only reading today that, you know, young girls dropping out of sport and PE at school is lower than it's ever been. And I think that problem there with how we move our bodies and how we understand our bodies at such a young age then transcends and sparks other issues as we move through life and through those different life stages. And then it's a lack of research. You know, there's such a lack of, a spotlight shone on women and the research that needs to be done in understanding female health. And that comes down to funding, it comes down to the complexity, you know, to understand a female's body and understand how we are so individual and it's not a one-size-fits-all is often too complex and too complicated, that we often see that kind of research just gets put to the side. And then it has a knock-on effect to founders and, you know, the way that VCs see, you know, female founders, because that research isn't there. But as women, we know that we feel dramatically different through different stages of our lives, and particularly through our menstrual cycle as well, which is with us all the way up to, you know, perimenopause. So for me, it's definitely down to education. How do we educate more women? How do we educate the men around us? And then how do we increase the amount of studies that we do in this area and really give it the funding and time to reduce that gender gap? Because, you know, it's huge. It's absolutely huge. And it's quite alarming for me as a mother as well. I have a young daughter who's only 6, but I constantly think about, you know, what is this gap going to be like in, you know, 5, 10 years' time? How will she feel about talking about her health problems? Will she accept a certain level of pain, which a lot of women do accept and have accepted for a long time? Or will this become a topic that's very easy to speak about and has more attention and, better outcomes?
Absolutely, and perhaps also for the audience, because we speak a lot about education, and in case you haven't read it yet, I really can recommend the book which is called Invisible Women, Data Bias in a World Designed for Men, because that for me a few years ago was really an eye-opener when I read it. It gives you a lot of concrete examples of where indeed the treatment options and you know, women's health is being treated in a very, very different way. So it's called Invisible Women, so I would look it up on the internet and order it if you haven't read it yet. But Pooja, I think you wanted to come in as well.
Yeah, I also wanted just to bring attention to the biases within biases, a little bit going back to the point about the elderly, but everyone is sort of, you know, looking for the next diagnostic for endometriosis, which is brilliant. We, in our fund, have been looking and searching. But, you know, you'll note that adenomyosis, which is a similar condition, has the same prevalence, but actually it appears later in life after you've had children. So lots of the focus on endometriosis is in part because of the reduction in fertility, whereas actually the same number of women, you've got double the number of women experiencing exactly the same type of pain and diagnostic delay, potentially more with adenomyosis because it's less well researched. And looking at how we might find a diagnostic, I don't think it will, at the moment, I'm not entirely sure that physiologically it will discriminate between endometriosis and adenomyosis either. So we just have these little biases because it affects your childbearing. We are very focused on endometriosis, but yet we have this a condition of older women postnatally. So, you know, we've got to re-engineer that data gap in the most significant way. But I just think all the people who probably could do that are in the room and at this conference. So that's the hope that I have, is that when smart people from different angles get in a room together and are incentivized to do it, you will get that.
Well, thank you so much, because we're at the end of this conversation. I feel it's only the start and we could have gone on much longer. But thank you so much for you, I think, for our fantastic speakers. So give them an applause, please. But also thanks to you. Really, it was great to have such an engaging audience. And I think it's important to end with the fact that all of us in our own worlds, be it professionally or privately, we can make a difference. And if we all spread a word, and I hope that indeed the topic of female health and women's health indeed get the attention that it needs. Thank you so much.